offices tend not to be open as normal over the weekend, so the Sunday and Monday figures are often lower. Of course, we also reported 11 deaths on Saturday and 1 yesterday. So since the last briefing on Friday, 13 additional deaths have been registered, which takes the total number under this measurement to 2,701. And that, of course, reminds us again of just how dangerous this virus can be. And I want to send my condolences again to everyone who has lost someone. I'm joined today by the Health Secretary. She'll say a few words in a moment about the Scottish Government's revised testing strategy and about preparations for winter. And then I and Professor Leach will take questions as normal. Firstly, though, I will give a brief preview of the week ahead before updating on one particular issue. As you recall, on Friday, we published our strategic framework for tackling COVID. That framework included the proposed levels that will apply to different parts of the country depending on prevalence of the virus. Over the weekend, we've discussed the framework with partners and considered further public health advice. These discussions are continuing, as are discussions with local councils. There are likely to be some clarifications to the detail of the levels we set out on Friday, and so we'll publish a revised version ahead of the parliamentary debate that will take place tomorrow. And of course, we will keep the detail of the levels under ongoing review as the pandemic develops. We'll also set out more detail ahead of tomorrow's debate on the factors that will guide decisions on which levels apply to different parts of the country. And assuming Parliament agrees the draft framework tomorrow, Ministers will decide later in the week on advice from the National Incident Management Team and our Chief Advisors, and in consultation with local councils, what levels will initially apply in what parts of the country from Monday the 2nd of November. And I would remind you that in broad terms, the current restrictions in place in the Central Belt are equivalent to the proposed level 3, and those in the rest of the country broadly equivalent to level 2. So for many places, there may be no immediate change. For an area to come down a level, we want to see a fall in the prevalence of the virus be sustained, not just seen on 1 or 2 days. And that, I think, is important in giving business stability, but also in giving people confidence that we are not going to take unnecessary risks when we start to lift restrictions. So the next few days we'll see some important decisions, which of course will have an impact on all of us. I think it's important for context, though, for all of us to remember, given how tough all of this is, that these decisions are one that Scotland is facing in common with countries across these islands, across Europe and, of course, across the world. Many countries are facing having to impose or reimpose tough restrictions, especially on hospitality, as a second wave of COVID takes hold. The purpose of adopting tough restrictions just over 2 weeks ago here was to try to curb the increase in COVID cases that we were seeing before the virus ran further out of control. And the daily figures I have been reporting recently, as I indicated on Friday, suggest that these restrictions are starting to have an effect. We do think that the increase in case numbers is slowing, but it's not yet in decline, which is why we can't be complacent. But we should take encouragement from the daily numbers at the moment, because they suggest that these sacrifices that everybody is making are starting to work. Once the new 5 levels approach is adopted, and once people get more familiar with it, which I know will take a bit of time, I hope people will be better able to understand on an ongoing basis the spread of COVID in their particular area, and also what measures are necessary to tackle it. And hopefully that in turn will underline a key point. The best way of moving to a lower level of restrictions and of living more freely is to have a lower level of transmission of the virus. And the best way, of course, we have of driving transmission lower and keeping it low is for all of us to stick to the rules that are in place at any given time. And that, of course, is a collective responsibility for all of us. Now, the second point I wanted to briefly highlight today was that 2 more walk-through testing sites have opened in the past few days. On Thursday, a new site opened in the centre of Greenock in Inverclyde, and on Saturday, a centre opened at the Highland Council headquarters in Inverness. That means that in total, we have 11 walk-through testing sites now open to meet the needs of local communities across Scotland and to try to make access to testing easier for people. And I want to take the opportunity to thank everyone involved in setting up these sites and, of course, all those who are helping to run them. The walk-through centres are only part of our testing infrastructure, obviously, but as I said, they are an important way to try to make testing more accessible in our towns and cities. So we'll continue to work with partners, including the UK government, to establish more of them in the weeks and months ahead. It is possible to book a test at a walk-through site by going to the NHS Inform website. Please remember that though they are walk-through sites, because they are walk-through sites, you should seek to walk or cycle or drive to them, but do not use public transport to travel to any testing centre. If you don't have a car and you can't walk or cycle to get a test, then you can book a home testing kit through the NHS Inform website. Of course, the reason for that is to ensure that you don't transmit the virus unwittingly on the way to or from the testing centre. I would simply end this part of the update by reminding everybody again that if you experience any of the symptoms of COVID, it is really important to self-isolate immediately and take immediate steps to get yourself tested. Let me end, as usual, by stressing the other key rules and guidelines that remain in place for now. If you live in Lothian, Lanarkshire, Forth Valley, Ayrshire and Arran and Greater Glasgow and Clyde, you shouldn't travel outside these areas unless you have a clear need to do so. And people living in other parts of Scotland should not travel to these areas unless necessary. None of us anywhere in Scotland should be visiting each other's homes just now, except for specific purposes like childcare or looking after a vulnerable person. And when we do meet people from other households, outdoors or in indoor public places that are open, for example, cafes, we should keep to a maximum group size of 6 from a maximum of 2 households. Avoid car sharing if you can, work from home if you can, and remember to download the Protect Scotland app if you haven't already done so. And lastly, remember the key rules that help keep us all safe when we are out and about. Wear face coverings, avoid places with crowds of people, clean your hands regularly and remember to clean surfaces too. Keep 2 metres distance from those in other households and self-isolate and get tested if you have symptoms. If we all stick to these rules, follow all of that advice, then hopefully the encouraging signs we are seeing in the figures that we are reporting every day will not just continue but accelerate, and a slowing of the increase over the weeks to come will become a decline in the number of daily new cases. Thank you all very much. I'm going to hand briefly now to the Health Secretary before we all take questions.
Thank you very much, First Minister. Over the months of the pandemic, our testing capacity in Scotland has grown, both in NHS Scotland and in partnership with the UK Government. As we've said many times, testing is an important part of our public health response to the COVID-19 pandemic. The refreshed testing strategy, which we published in August, has been supplemented by the clinical and scientific review carried out by clinical and scientific leads and published last Friday. The unanimous view of clinical and scientific advisors is that the overriding priorities for testing capacity in Scotland are ensuring all people with symptoms can access testing and testing for clinical care. Their advice is clear that as testing capacity increases, routine asymptomatic testing should be expanded to protect those most vulnerable to harm from the virus, including residents in care homes. Scotland is on track to increase overall testing capacity to 65,000 tests per day by winter. A significant proportion of that increase will come from the work underway to create 3 new regional laboratory hubs. The hubs will open during November and December, and when fully functional, will provide at least an additional 22,000 tests per day for NHS Scotland. The hubs will be used to complete the transition, which we've already begun, of care home staff testing away from the UK Lighthouse network, thereby freeing up capacity there for other testing use. And the hubs will also provide additional capacity and resilience to our health boards throughout the winter period and beyond. Using the clear advice from our clinical and scientific advisors, we're working through how we can extend asymptomatic testing to other groups, remembering the focus is on protecting the most vulnerable. That therefore includes staff delivering care at home, care home visitors, NHS and other professional staff who go in on an infrequent basis to care homes, and NHS staff, particularly in critical patient-facing areas. In all of that, it is vital that we plan and deliver in a way that delivers test results as quickly as possible. And that includes continuing our work with the UK Government on the Lighthouse Lab capacity, because having quick test result turnaround times feeds directly into our Test and Protect service to reduce transmission by speedy contact tracing and isolation of close contacts. In all of this, we continue to engage closely here in Scotland and across the nations of the United Kingdom to identify how new innovations in testing and in the processing of tests can help us increase capacity. This additional testing capacity is a key part of all the steps we are taking to ensure that the NHS is in the best position possible to respond to the significant challenges it will face over the coming months, when the impact of the COVID cases will be exacerbated by all the more usual winter pressures. For that reason, Test and Protect, incorporating the expansion of testing capacity, improving turnaround times, and staying on top of contact tracing is one of our key priorities, and that will feature in our NHS Winter Preparedness Plan, which will be published on Wednesday of this week, the 28th. The plan will also set out the importance of our vaccination programmes, as well as the priority we're giving to maintaining essential services in the NHS through the coming months. We have seen the combination of the incredible commitment of our health and social care staff alongside the unstinting support and perseverance of the Scottish people. And that has meant that in the months of the pandemic, the NHS in Scotland has not been overwhelmed. My priority, as we will set out in our preparedness plan, is to ensure that that continues to be the case. Thank you.
Thanks, Jean. We'll move straight to questions now. Jamie McIver from BBC.
Good afternoon, First Minister. The Deputy First Minister said this morning there was a realistic possibility students may be told not to go home at Christmas. How quickly is there going to be a plan to allow students to go home safely over Christmas? And what's your message to any students who are worried, maybe even anxious or distressed about the possibility, the prospect of being stuck in halls of residence over the holidays? And separately, there are reports that the UK government is considering shortening the self-isolation period. Is that being considered here too?
Thanks, Jamie. I will try to briefly answer both those points, but on self-isolation, I'm going to hand over to Jason to say a bit more about that. To students who are worried and anxious, I know you'll be worried and anxious, and we will do everything we can over the next few weeks to set out a path that sees you able to return home for Christmas. That is what we all want to see. What we're trying to do right now on students going home for Christmas, on every other aspect of this, is be clear in what we want to do, but also be frank with people about the inherent uncertainties in the situation we're living through right now. And that's not easy for anybody, but it's better to do that, I think, than give people false assurance that we then have to come and take a step back from later. But be in no doubt, we want students to be able to return home safely for Christmas. So we are working with other UK nations, but within the Scottish Government, we are working on plans that the Deputy First Minister alluded to over the weekend, which will encompass a combination of things, a potential phased end to the current term to allow students perhaps to have some period of time away from other people, a staggered start to the new term to avoid everybody coming back all at once, to use testing in some way to try to help with that, and also to provide as much advice to students as possible about how, if they are going home, particularly if they have vulnerable family members where they might be returning to, they can keep themselves and family members safe. So we'll set that out as early as we can, with as much certainty as we can. But the really difficult thing in all of this is that we are living through an inherently uncertain and unpredictable pandemic, and that means we can't always give the absolute cast iron certainty on anything right now that I know people desperately want and I desperately would like to be able to give. We have to steer the country through this and find the safest possible paths with as much normality attached to them as we possibly can. We have no plans at the moment to reduce the period of self-isolation, but of course all of these things remain under review. As previously, of course, the period of self-isolation for those with a positive test was reduced from 14 to 10 days. We keep all of this under review. We don't want people to live under the most severe restrictions for longer than is absolutely necessary. But I'll hand over to Jason to say a bit more about that.
That is basically the position. We have no plans with the present clinical advice to change that in any way. As far as I know, there is no clinical advice in the other 3 UK countries. The 4 UK countries meet on a Tuesday night as clinicians. This is exactly the kind of subject we discuss. That's where we started to make decisions about reducing the positive case isolation from 14 to 10. It's important to reinforce that the 10 days is only if your symptoms have gone. So it's 10 days or your symptoms date your symptoms end. So there's no present plan, but we keep it under constant review globally and locally. And if we think the incubation period has changed or we think the risk has changed in some way, then we will of course advise appropriately. But for now, I'm afraid it's still a 14-day self-isolation.
Thanks. Peter Smith from ITN.
Can you? Yes, I think I'm hold on. Can you hear me? Hello? Hello?
Yep, you're a bit crackly.
Yeah, signal's not great. Sorry, First Minister. I was just noticing on your level 4 restrictions, there are plans to close non-essential shops and retail. Are there any plans to restrict availability in Scotland's supermarkets under level 4 restrictions?
We would have no current plans to do that. Obviously, we hope we don't have to go to level 4 in any part of the country, but we can't rule it out. And it's important that we set out what something closer to a full lockdown would be. But we have no plans to do that. But obviously, all of these things get kept under review. Ross Govins from STV.
Afternoon, First Minister. NHS Tayside has warned COVID rates in Dundee are currently higher than in some of the areas in the Central Belt, where you have enhanced restrictions. How close is Dundee to moving to further restrictions? And another question briefly, if I may, as you consider what areas to put in what tier level, how problematic do you think people moving from one area to another with possible differing regulations may be?
As I've said repeatedly, and it's, can I say just as I suppose a general comment that, we'll all take a little bit of time to get used to this potentially differentiated approach. I think it's better to have that than have the whole country live under really tough restrictions that might only be necessary in one part of the country. But if we have a differentiated approach, it is highly likely that that will be accompanied by advice not to travel from lower prevalence areas to higher prevalence areas. That will be one of the trade-offs that allow lower prevalence areas to live under less restrictive conditions, and that will be part of what we set out. It's also, I think, important, and this will, we'll talk more about this later in the week as we start to make these decisions. We're already in early discussions with local authorities about different levels in different parts of the country, but it may be as area moves down a level, then that comes for an initial short period with some extra safeguards. If you look closely at the levels we published on Friday, at level 1, for example, we said that while eventually what we'd want level 1 to be would be people able to meet indoors with 6 people from 2 households. There may be some circumstances where even at level 1 we still restricted household gatherings for a period if it was decided that there needed to be a bit of extra safeguards. So these will be fine judgments that it will be important for us to set out. The final point I would make, Jason might want to add in relation to the first part of your question, is yes, Dundee is an area that we are looking closely at. And as we allocate parts of the country to levels, it is quite likely that significant parts of the Central Belt, for example, might stay in broadly the level they are in just now for a further period. But Dundee would be one of the areas where there is a question at the moment about whether it needs to go up a level. No decision has been taken there. but it is one part of the country we're looking at closely. Lanarkshire is another part of the country that, as I said on Friday, we have had some concerns about the level there, although I think the latest advice I have today is that there may be a bit of optimism that the situation in Lanarkshire is starting to stabilise. But we look at these things on a very close basis, literally every single day.
So on both of those elements, the Dundee City does concern us. The NHS Tayside Health Board has 60 cases today. It's been around that level for a few days now, but they are concentrated in Dundee City, and that's what you would expect in an urban centre. We know that is, in the main, a higher risk when there aren't specific outbreaks in the rural areas. So we do, locally, the public health team and nationally, remain concerned about Dundee City. The travel public health advice is relatively straightforward to say. It's, of course, hard to implement. We don't want people moving from high incidence areas to low incidence areas because you potentially take the virus with you. And we don't want people going from low incidence areas to high incidence areas because you potentially catch the virus when you go. And that's true if it's the Balearic Islands, or it's Perth and Kinross, or it's Dumfries and Galloway. And that advice will be what we say. And then in the framework, in the tiers, there will be implications depending on which tier you end up.
Peter McMahon from ITV Border.
Thank you, First Minister. First Minister, NHS Borders Health Protection has said today there are 17 confirmed COVID cases in the Jedburgh area. That's a relatively large number for a small town, related to family groups and home care services provided by SB Cares, which is effectively Scottish Borders Council. Can you give any more details of this? Is it the family groups? Is it the home care services that are the cause for concern? Should local people be worried about this? And is this likely to contribute when you come to consider what tier Scottish Borders will be in when you get those measures in place for next week?
I'll ask Jason if he can give any more detail on the specific cluster of cases you are talking about. Generally, from me, all of this feeds into that decision-making process. There will not often, if ever, be one single factor that decides whether a part of the country is at one level or another. There's a range of things we have to take account of, which is what makes it quite difficult. It would be easier if there was just one single driver. But secondly, should people be worried? People in every part of the country right now should be very vigilant about complying with and abiding by all of the advice and all of the rules that are in place. Whether you're in Jedburgh or Orkney or Glasgow or Dundee or any part of the country, the most important thing for all of us as individuals to do is follow all of the advice, make sure we're staying out of each other's houses, make sure that we're washing our hands, wearing face coverings, doing all of the things that we stand here every day and advise people to do. And that's the most important thing every single one of us as individuals can do. Jason, can you add any more detail on that cluster?
I am aware of the Jedburgh outbreak, the 17 people. Some of them are care workers, but not by any means all of them. This allows us to illustrate the difference, of course, between an isolated, potentially isolated outbreak that will be managed and controlled by the local public health team, and that's what I would anticipate. The incident management team for Borders meets again today to consider these 17 cases and any more that may have arisen today, and the contact tracing and how well that is going. That will, of course, influence what the tiers eventually do and how you move in and out of tiers. But remember, if we get local public health, test and protect, working well, we will manage that kind of outbreak. Although people may get sick and it's still horrid to get the virus, that's very different from community transmission across a large area of Scotland where you can't manage it as individual outbreaks. So the Jedburgh outbreak is presently controlled, and the incident management team will meet again today to see if there's anything else they need to do or anything else they need from us.
Alan Smith from Bauer.
Thank you, First Minister. Just a question in regards to the testing strategy. Radio Clyde has spoken with the family of an 81-year-old resident of a care home in Glasgow who has dementia. He was tested at the start of last week after displaying symptoms, but a week on, there's still no results, and the family are feeling a little bit anxious at the moment. I know you can't comment on the individual circumstances without specific details, but is the Scottish Government aware of any issues regarding the turnaround time for care home residents' results? And will this testing strategy ensure a quicker turnaround time for care home residents?
I'll hand over to the Health Secretary in a second, but can I say firstly, thank you. I know you've already passed the details of this individual case to us. It is being looked into. I haven't yet had a report from that, but we will make sure that whatever the situation is with the individual concerned, that's rectified as quickly as possible. I am not aware of any wider issue that would be behind that, but obviously I don't want to say any more until I've had the report back from the investigations that are being carried out. Clearly, part of the rationale for transferring care home testing from the Lighthouse network into NHS Scotland is to speed up that turnaround time, and that's why that process is underway and ongoing, but the Health Secretary can say more.
Thanks very much, and I really am sorry for to that individual and to his family that they still don't have a result. Of course, I am sure the care home concerned will have instituted enhanced infection prevention and control measures whilst they await that result to ensure that the individual is being looked after, but also that they are ensuring that there is no opportunity for transmission between that individual and any other resident, and staff will have the appropriate PPE and be following all those procedures as that important protective measure. As the First Minister said, part of the reason for moving care home staff testing away from the UK Lighthouse Lab to the new NHS regional hubs, we've already begun that work. I think just over 10,000 of those tests, of about 38,000 every week, have already moved to NHS labs, is so that we can oversee that more closely, because they're NHS Scotland testing processes, and the average turnaround time in NHS Scotland labs is 27 hours. The UK Lighthouse Lab in Glasgow is part of a bigger UK network, and that can mean that turnaround times fluctuate, although we've worked really closely and continue to work really closely with the UK government to find ways to improve those turnaround times. And I know that there have been some new steps put in place in order to ensure that the logic of the processing is more streamlined, so that tests that come in are processed by their time date, if you like, as opposed to by any other means. So we should continue to see improvement in those turnaround times from the Glasgow Lighthouse Lab. None of that, though, for this particular individual is any comfort whatsoever. So as the First Minister has said, we will look at that specific instance and see if there is more that we can do to help.
Shona Duthie from Original 106.
Thank you, First Minister. We've been speaking to the owners of soft play areas this morning about the ongoing restrictions. In the framework, it suggests that tiers 0 and 1, the likes of soft play centres and sports stadiums, will be allowed to reopen. Will that happen automatically as soon as a region is placed into one of those tiers? If not, what will the threshold be for those businesses to be able to reopen, and how much notice will they be given?
The assumption under the levels that we published on Friday was that at levels 1 and 0 that soft play would be able to reopen, and unless there was some reason to change that, that should be the working assumption. Obviously, we'll set out details of what part of the country goes into what level later on this week, so I won't go into any more detail, but that's the assumption that we are working by. Do you want to say any more?
Well, only the guidance is available for all of those areas, and when that happens, we'll give as much notice as we can. The guidance has been written in consultation with each of those sectors, whether it's the tourism industry or the soft play area.
Neil Pooran from PA.
Thanks, First Minister. A question on rapid testing. You might have seen today that Boots pharmacies are soon going to be offering nasal swab tests for coronavirus that can be turned around in 12 minutes for a cost of about £120. I think the Scottish Government was in discussions with the same company that offers these tests a few weeks ago. So I was wondering if you can update us on if there are going to be any trials using this rapid testing strategy, and also if maybe the Health Secretary can set out how they will be rolled out for care home visitors. If she can update us maybe on the timeline for that, as I know a lot of people with relatives in care homes are quite keen to see them as quickly as they can.
I'll hand over to the Health Secretary in a second. I'm not able to give any more detail just now on that specific test and its use within the NHS, but as we've said before, we are very keen to deploy new technology that allows for quicker testing and testing to be done closer to the person as far as we possibly can. And, you know, I stress that we are keen to use any developments within the NHS, because what we don't want is a situation where you can only access a certain test if you are able to pay for it. We want testing that is reliable and we think contributes to the overall battle against COVID to be available through the NHS, and that is a work in progress. But I'll ask the Health Secretary to add anything she wants to.
If I could just say a couple of things, one of which is to specifically answer your question. I said in my earlier statement that we continue to actively engage with new technologies, both in the actual test that's used, but also in the processing. There are pilots underway. There is validation of different type of test underway here in Scotland. What is important that tells us in all of this is how sensitive a test is and how specific it is compared to the standard PCR test, which, of course, as you've heard the Chief Medical Officer and Professor Leach say many times, is the best we have at this point. But it takes longer and it involves the discomfort of the swab. So as we get the results of those, and a lot of this work is happening at pace, then our clinical advisors will be able to tell us where individual different kinds of testing process makes most sense for us to use it. And that in part takes us back to your question about the designated care home visitor. So this is the visitor and there two for each resident that is able to go indoors and spend longer with their loved one and with appropriate PPE and so on. Also the importance of touch and being with someone perhaps over lunchtime or whatever it might be. Now, one of the additions that we can add to that is the testing of those individuals. So when I said earlier that we're working through what testing capacity do we have, what kind of test could we use, we plan that against the numbers of the different cohorts of asymptomatic groups that the clinical advisors have advised us are important groups of people to try and bring into testing, because that helps us protect those who are most vulnerable. So that work's underway. I think I'm due to speak to the care home relatives group in about a week's time, and I'd hope to be able to update them at that point on the progress we're making.
Can I just make one last point on the rapid testing? Because I think it's important, you know, we should all be very enthusiastic about new technology and the contribution it can make to the fight against this virus. But it's important we don't overstate certain things, because a rapid test done on one day that shows you are negative does not mean you will be negative the next day because of the incubation period of the virus. So it doesn't necessarily mean that you can go and buy a test in Boots, test negative, and then not abide by all of the rules and all of the guidance. It's not quite that straightforward. So I think we have to be enthusiastic about the role of different testing approaches, but also be clear that we all have to do these other things as well for the foreseeable future. Do you want to add anything on testing? Mm-hmm. Tom Peterkin from the P&J. Tom, are you there?
Yeah, sorry about that, First Minister, sort of a slight delay. Good afternoon. There are new figures showing that job seekers in Aberdeen have the lowest chance of securing work in the UK. This has been put down to collapse of jobs in hospitality, retail and the arts. The figure is there's been a 75% fall in employment vacancies. Does this add more strength to the arguments for those who are arguing that the North East should be given more help?
We want to help businesses in every part of the country that are either required to close because of the virus or are restricted in how they can trade. And that was the the objective behind the business support package that we set out on Friday as part of the strategic framework. That's the maximum we can do within our resources, and I set out some concerns about the finite nature of those resources on Friday. We think there should be more support for workers and business, and continue to try to persuade the UK Government, for example, to extend the support through the job support scheme. So these discussions are ongoing. There's a really fundamental point here, which is really difficult for everybody to grasp and to accept, I guess. It's not restrictions that are harming the economy. They are harming the economy, but it is the virus that is forcing these restrictions that is harming the economy. We will do more harm to the economy if we allow the virus to run out of control. So we have to balance all of these different harms. I spoke a bit about that on Friday, and we'll continue to speak about that. But we absolutely have to keep this virus under control, or all of the other harm that has been done to wider health, to the economy, to people's livelihoods will be exacerbated. And the way to get the economy back on a path to sustainable recovery is to suppress the virus. And that's been true all along. And unfortunately, all these months on, it continues to be true. Chris Musson from The Sun.
Good afternoon, everyone. First Minister, on the issue of known positive COVID patients being discharged to care homes during the first wave of the virus, you'll be aware that a Sunday Post story on August the 16th said that there were at least 37 such cases based on figures from health boards via FOI. But way back on April the 22nd at this briefing, I asked you a question about allowing COVID-19 positive patients to be placed in care homes, and whether that, as well as transfers to care homes of untested patients, was a reckless practice. So can I ask today, was April the 22nd the first time you heard about this practice of sending known positive patients from hospitals to care homes?
I'm trying to be really clear here, because I don't want to be in any way defensive about the decisions we've taken. We've got some things wrong and try to rectify those things as we've learned more about the virus and how it spreads. So we have known, and I'd need to check the precise dates, forgive me Chris, I don't have them in front of me. Of course we have known that there were concerns about older people without being tested going to care homes and the risk that created. I have said in the last few days in response to an MSP in a letter that we didn't know about specific test results, those that were reported in the Sunday Post through a Freedom of Information request, and that is the case. Of course, we've asked, in order to deepen not just government's knowledge of all of this, but the public's knowledge, we have asked Public Health Scotland to do an in-depth study of this issue, looking at discharges from hospital to care homes and the testing status and the implications of that. That work will be published by Public Health Scotland on Wednesday this week, so people will be able to look at that in much more detail. We want to learn from all of this. I think we're the only part of the UK as of now that has asked for that study to be carried out. If we could turn the clock back to the beginning of this, there's probably not a government in the world that would not say there are certain things that they would have done differently based on the developing knowledge we have now. But unfortunately, we don't have that ability, and we have had all the way through this to try to do the best and take the best decisions based on the knowledge we have had. Well, we have got things wrong, undoubtedly, but what we have done has been done with the best of intentions, based on the best advice and information that we had at the time. Rachel?
Can I just double check on this, just to come back in then? If you were aware of concerns back in, say, April, and you've not been clear about when you were aware of these concerns about known positive patients, what did you do at that point when these concerns came to you via whatever means, be that via a media briefing or via other channels? What did you do at that point?
We have had ongoing discussions about the role of testing in care homes. So we over a period of time, and forgive me, I don't have all of the dates in front of me right now, so I'm not going to remember them all exactly, but you know what they are, and I can go back and provide them to you. But we changed the position on testing older people going from hospital to care homes as a result of changing advice on things like the role of asymptomatic transmission of the virus and the efficacy of testing in these circumstances. So at every stage, the idea, I don't and will never ever stand here and say that we didn't get things wrong. And the implications of some of the things that, you know, all sorts of governments will have got wrong over the time, you know, people like me who've taken the decisions have to live with that forever. But the idea that at any point I or the Health Secretary or anybody in the Scottish Government just decided we didn't really care about older people going to care homes is just so far from the truth. And actually quite offensive to all of us, I think, as individual human beings, let alone decision makers. So that is not the case. What I am very clear about, and you know, I'm trying to be helpful here, not to be the contrary. You know, of course, it was widely debated at the time about the role of testing and the risks of not testing people, but we didn't know about specific test results before that was reported through the Freedom of Information request. And of course, it's because we want to have a deeper understanding of that for accountability as well as for learning lessons of the future that alone amongst the UK nations we've asked Public Health Scotland to do the in-depth study that they've been doing. It's taken longer to do than we had originally hoped, but that work will be published on Wednesday and you will have the opportunity to ask me, the Health Secretary and others about the detail of that when it's published. Rachel Watson from the Daily Mail.
Thank you, First Minister. Today, a former senior police officer has raised concerns about resentful and people becoming resentful and rebellious about restrictions. How concerned about that are you? And also going into the Christmas period when different parts of the country could face different restrictions, even on Christmas Day, for example, over how many visitors they can have in their household and, you know, warnings that students might not be able to go home. How resentful will people become, and do you expect people to stick to that even on Christmas Day, and how will you enforce that?
You know, I think despite the best efforts of some, sometimes people are actually really quite mature about this. They know we're living through a global pandemic of an infectious virus. None of us like the restrictions we're living under. Yes, I guess when you go into a situation where, as we are just now, some parts of the country will be living under different restrictions to others, and we've had that already to some extent, then yeah, those frustrations grow. I don't know, is it better then to have everybody living under tough restrictions even when the virus is lowered in some parts of the country? There are no easy answers to all of this. We are living through an unprecedented, in our lifetimes, global pandemic. And I think most people, it's not that they don't feel frustrated and depressed and angry about what we're having to live through. There's not a single one of us, myself included, that doesn't experience all of these emotions on a daily basis right now. But I think most people understand that it's just unavoidable given the nature of what we're dealing with. And we have to get through this, and we have to get through it in the best way we possibly can. And that's the reality. And you know, I know that doesn't always make for the kind of banner headlines that newspapers think sell newspapers. I'm never sure I'm as convinced, but that's the reality. And in my experience, people don't like it because none of us want to be living under these conditions, but people understand the reality of what we face and that we'll get through it quicker and better if we take sensible decisions now. Dan Sanderson from the Daily Telegraph.
Thanks very much, First Minister. Yeah, can I just check something on the tier system? The document you put out on Friday seems to suggest that pubs and restaurants, even in level 3, so the second highest level, could stay open as long as they didn't serve alcohol. I tried to check that on Friday, and I was basically told that there would be further discussions with the hospitality industry over the weekend. So can you just confirm what the current situation is for pubs and restaurants who, you know, the central belt ones who are likely to be placed into level 3? And also, has the decision by the hospitality industry to take legal action, or at least threaten to take legal action against the government, contributed to the decision in any way? Thanks.
No, it hasn't. We have to take decisions based on what we think is necessary to protect people from a virus. If I wish I could take legal action against the virus and stop it, but I can't. So you know, we have to take the best possible decisions. And I've said before, we live under the rule of law, even if we have emergency laws in place just now. So I don't criticise anybody for if they think they've got the right, if they think they've got a reason to do it. I don't criticise anybody for testing the position in the courts, but you know, it doesn't necessarily change the reality that we're living with. We're having discussions with the hospitality sector around the detail of this. At the moment, under level 3, what we have suggested is that alcohol would not be permitted in hospitality settings, but it may be possible to have premises serving food that may still be subject to restricted opening times, and it is likely to be, substantial meals as opposed to snacks. But that is detail that we are discussing with the hospitality sector as we finalise these things over the next period. One final point, just to make, it's we've got to keep a degree of flexibility in response to this virus, because it's flexible in how it spreads, so we can't become too rigid. But we want to have a situation where we don't have different parts of the country under the same level, but different restrictions applying. We want consistency, but it may be the detail of these levels as we learn more, as we go through this change. I used an example earlier on that in level 1, it may be for a period of area goes to level 1, we'll still ask households not to mix indoors, even although ultimately we want to move away from that. And similarly, opening times for hospitality in level 2 or 3 at the moment, in 6 weeks or a few months from now, as we have more confidence about how this is all going, that could develop. So we want to give greater certainty and clarity, but we should never become prisoners of a rigid system, because we are up against a virus that itself is very flexible, so we need to retain some flexibility too. Gina Davidson from the Scotsman.
Hi, thanks, First Minister. Can I ask for an update on what's happening with the Red Mill care home at all, where there have now been 11 deaths? I know there's been demands for an urgent care inspectorate investigation. I wondered if that was likely to happen, and just how helpful HC1, the owners, are being with what's happening there. And can I also just ask, following up on the Boots question, would you advise people maybe not to part with £120 for a test that is possibly only useful for one day?
On the testing, the advice we give people will be how we use testing through the NHS. I can't sort of stop people spending money on things they want to spend money on, if that's done legally, obviously. But I would encourage people to look at the advice and the strategy within the NHS, because that's what we're trying to develop in a sensible way and on an equitable basis, rather than people thinking that they can spend money, get a test, and it is a sort of get out of the virus free card. For the reasons I said earlier on, that's not the case, and I think it's important that we set that out to people. Obviously, the care inspectorate can take whatever action it deems necessary in the case of individual care homes. I don't have any further detail than is already known on Red Mill right now. The Health Secretary may have, but I'll ask her to talk a little bit more about the care inspectorate and the approach they will take, whether there are any concerns about the situation in individual homes.
Thanks very much. A couple of things to say. I mean, the first thing, obviously, is to express my sympathies to the families who've lost a loved one, and also my concern for those families of other residents who will be completely understandably anxious and worried at this point, as indeed will staff there. All the information I have is that both the provider, HC1, and the staff are engaging very constructively and positively with NHS Lothian, who, of course, through their Director of Public Health, are continuing to ensure that the home has the level of resourcing it needs, has all the PPE it needs, has the clinical care wrapped around it to ensure that we can control the transmission of the virus there and look after the residents in that care home with that clinical and important social support. That's the situation, the most up-to-date knowledge of the situation that I have, although I do look at the situation in all our care homes where there are outbreaks, regardless of whether it is one case or more than one case, every single day with the reports that I get, and follow those up including in discussions with the Care Inspectorate. But as the First Minister says, the Care Inspectorate takes decisions about where it thinks it needs to intervene or where it wants to and thinks it needs to provide additional support. But it also monitors, including with Health Protection Scotland and Health Improvement Scotland, the work in care homes to ensure that they are as supportive as they can be to have the levels of infection prevention and control that we need them to have.
Tom Gordon from the Herald.
Hello there, First Minister. My first question is for the Health Secretary. The Herald's reporting today the story of a family of a 90-year-old woman who has just lost her sister, her lifelong companion, and she's heartbroken. Now, this lady is a resident of a home that is run by the Glasgow Health and Social Care Partnership. The family would like to visit because she's in distress. And the Health and Social Care Partnership have said that is not possible because rules prohibit all visiting in care homes in their area at the moment. And as far as I can tell, that seems to be plain wrong because government guidance is that essential visits for residents in distress have continued in Glasgow and elsewhere. Leaving aside this individual case, in general terms, could you just remind us and the Health and Social Care Partnership what the rules are on essential visits? And briefly to Professor Leach and the First Minister, will the rules which apply to students at Christmas on travelling between different parts of the country and travelling between different households apply to everybody else? Or will there be a different system for students? Because you can imagine how that might put people's backs up.
I'll take that briefly. First of all, Jason can add if he wants, but I suspect there won't be that much he can add. That is one of the things that we are having to work through in terms of students. If we allow students to go home, then clearly our travel advice has to take account of that. So it may be, and please don't take this as categoric because we haven't reached decisions, that there are exceptions to that made for students if there is travel advice in place. But that is one of the things we're working through. I'll hand over to the Health Secretary on the question about care home visiting.
Thanks very much, and thank you, Tom, for raising it. I read the story in the Herald this morning, and as I think you might know, we were aware of it just shortly before it appeared in the paper, and have asked if there are further details that could be passed to us with, obviously, the resident and her family's consent, then I would want to look at this further. But on the question of essential visits in care homes and in hospital have been possible throughout the pandemic because there are really important situations where people require and should have that contact with their family. That can be at end-of-life care, often people know that an individual is dying, but they want to be with them during those last days. That is an essential visit. So is a situation where perhaps someone in a care home suffers from dementia and they are distressed by the necessary infection prevention and control measures that are in place, by not seeing their relatives, and that distress is also a reason for an essential visit. And circumstances where individuals are distressed for other reasons, and it may be the loss of a loved one, it may be other circumstances. Essential visits are important. So they've been there from the outset for a reason. Where we think there needs to be additional clarification so that everyone understands that, because the people who say it can't happen, they're doing it for the best of reasons. They are trying to protect the residents concerned, and I completely understand that and make no criticism of them at all. But in the guidance, the most recent up-to-date guidance that we published not very long ago, we took the opportunity to set out as clearly as we could what comes under, broadly, the term essential visits. We can't prescribe every single situation, but we know that individuals want to be able to exercise a degree of empathy and compassion in those circumstances, and that's precisely what essential visits are for.
Thank you. And the last question today is Mark McLaughlin from The Times.
Good afternoon, First Minister. Just a quick point of clarification on 65,000 tests by winter. Is that by the start of winter or the end of winter, and are you using the calendar that begins the 1st of December or the 21st of December? And the more substantive question was to do with the risk of getting coronavirus. Joe Hemmings, a behavioural scientist, was on the radio this morning, warning ministers to prepare for mass disobedience over Christmas because people either don't understand or don't respect the rules. Would it be responsible to have some better statistics about the risk of getting coronavirus in different age groups? You know, for example, there's been no deaths of people under 30. You're more likely to die of anything else, accidents, car crashes, things like that. Would that be a more responsible way to make sure that people take their own calculated risks over Christmas rather than just saying don't do it?
I'll come on to that point, and Jason may want to say more about that. On 65,000 tests, what we said is that by the end of the year, at the latest, we will have the 65,000 test capacity, but we want that to be as quick as possible. There are just some uncertainties around the ongoing work to establish the regional hubs, so we want it to be by the end of the year, but much earlier than that if we can, and it's building up as we go. On that second point, I don't think you're correct, although I will need to double check unless Jason has got more firm view, but I don't think you're correct to say there's been no deaths in Scotland of people under 30 any longer. But of course, it is much less likely that younger people die than older people. But it's impossible to be definitive to anybody. There is nobody that we can look at and say categorically, if you get coronavirus, you'll be fine. And that includes getting very seriously ill, but we know a lot of younger people become quite unwell for extended periods of time, the so-called long COVID. So I would be really cautious about giving anybody the message that you don't have to be worried about getting coronavirus. My message to everybody would be really do whatever you can to avoid getting it if at all possible. And of course, if you get it, then you might yourself not be at as high a risk of becoming seriously ill or dying, but you could pass it on to somebody who is at much greater risk. So try to avoid getting it. Look, we will have to give, we will have to see what the situation is at Christmas. The more we can be successful now in suppressing the virus, the more normality I think our official guidance will be able to have for Christmas. And then, yes, of course, we will have to recognise the realities of the situation and give people the best advice about staying safe. But the most important advice I can give to people right now is that if we do everything that's been asked of us now and get the virus to lower levels, then that opens the potential of having not 100% normality by Christmas. I would not be being straight with people if I said that was on the horizon, and I don't like that any more than anybody else does, but it will open the door to a greater degree of normality and hopefully a greater degree of being able to interact with at least some loved ones over that period. Jason?
The reason we're in a pandemic is that you cannot, around the world, allow individuals to assess their own risk and make judgments because the effect that behaviour has on the rest of your population. That's an endemic infectious disease. We do that for tuberculosis in Scotland, for example. We don't all live as though our risk of tuberculosis affects everybody else. But at this stage, in a global infectious agent like this one, you have to behave in a pandemic way, not an endemic way. Eventually, we will come out the other end of that, and we will almost certainly have to live with this virus for a longer period, but knowing our risk, managing that risk. But just now we have to manage at a population level because you can't tell who's going to get it. Your chances of catching it as an adult don't vary much by age. Your chance of getting seriously ill from it do vary with age, but you are not immune to that serious illness if you're young. I've got a 41-year-old pal, I've mentioned him here before. He's a paramedic, fitter than me, and has been sick for 3.5 months with this disease. No pre-existing conditions, no reason why he would be unlucky, and yet he was unlucky. Now back at work, but struggling with that shift paramedic hard work. The other thing I was going to mention was long COVID, like the First Minister did. So I've got data in front of me here from King's College that says 14.5% of people will be ill for 4 weeks, 5% of people are ill for 8 weeks, and 2% of people are ill for 12 weeks or more. Now, we're learning about that all the time, what that illness means, when it goes away, what it leaves behind. So the risk of this virus is not just acute illness and potentially death. The other risk of this illness is chronic disease that we don't fully understand. So I'm afraid that's why these restrictions are so required for this stage.
Thanks, Jason. That concludes the questions today. Thanks to Jean and Jason for assisting with the questions, and thanks to Jill for doing our BSL interpretation today. Thanks to all of the journalists, and thanks to you for tuning in and watching. There'll be no 12:15 briefing tomorrow because we have the parliamentary debate on the new strategic framework tomorrow. I think that starts some time after 2 o'clock, but I'll make sure we advertise the precise time of it on social media later today or tomorrow morning if you're interested in watching. Please, my final point today is just to ask you again to stick with it. We do think these briefings right now are all very grim again. I understand that, but as I said on Friday and have repeated again today, we do think we are starting to see early signs of real progress in the data that we're reporting every day. The rate of increase has slowed. We've not seen the doubling of cases in a 9-day period that we were frightened of just a couple of weeks ago. So that suggests all of these sacrifices are working. But to keep them working and to send a slower increasing number of cases into a declining number of cases, we all have to stick with it and keep doing all of these difficult but necessary things. So thank you for that. Remember all of the advice, stay out of other people's houses, and remember all of the rules in the facts advice. Thank you just now, and I will see you tomorrow from Parliament and back here at 12:15 on Wednesday.